Again, I'm not one so much for the formal introductions. I know that there's a lot of accolades each of these speakers have, and Dr. Roman has done just so much throughout the world. In fact, I like to just tell this little story, and because it was, for me, it was just a baptism by fire. I met Dr. Roman, and she was somebody I call the ozone evangelist, who was so dedicated to the idea of promoting ozone therapy in the veterinary community. It really helped me get started, and one of the ways that she did that was, she told me, hey, I'm going to Japan. What if we put a training class on there? She was just going to, I think she was lecturing in China actually, and was going to stop over in Japan. So we decided to put a training class on in Japan. It was the first training class O3 Vets had ever put on anywhere. So we started in Japan, of course, so that we had to use an interpreter, and we had to try to finagle and put all this stuff together in another country, another language, another culture, at a university there, Nippon University. And it was a lot of fun. I love her passion. I love the fact that she cares deeply. She's humble. She is very humble, and I love that because, my experience has been, many of the doctors, veterinarians in this crowd have been extremely humble, but Margo is a great example for all of us in that, and I appreciate her for that. She'll listen to anybody and wants to learn, a continual, consummate learner. And so with that, I'm going to actually turn it over to Dr. Roman, who is going to be live streaming from her home, and we'll move again into our breakout and then into our Q&A later as we go. So, Dr. Roman, the floor is yours.
Okay, well, thank you, Jonathan. I hope it's more, it was getting choppy in some of the if people can make a comment and see if I'm choppy too. But thank you for the introduction. And it is a passion. And when you see something that has helped so many animals, and you can't show other veterinarians an opportunity, it is very frustrating. And you feel like, you know, when Marlene said, you know, when the only option is euthanasia or just let them just die whenever, you know, don't do anything. I just find it very, very frustrating because there are so many choices that we have now. And I really want to thank both Zach and Marlene for wonderful lectures. Zach, that was great. That was such a good lecture. And to have someone who is a recent graduate, especially from Tufts University, who has been extremely resistant to everything that I have done, because I was on faculty there for 8 years, and it is refreshing to see that a student came out of there with an open mind like yours. And please share that with everyone, because if we don't have open minds, we will not make this world a better place. We'll just be doing the same thing, and we need better things. So I'm going to share my screen here and go to my lecture and start it now. Oop. I want to go. Let's go. Come on. Go. Where is it? Here's this. 1 second. Okay, so play. Okay, so can you see my screen, guys? Can you see it?
Dr.
Yes.
Roman, can you hear me?
I can hear you. Do you see my screen?
Yeah, but I am going to have to ask you just for a moment to pause,
Okay.
and we're going to reset it here because it's not playing over our screen yet. Just a minute.
Okay. Is it working now?
Okay. Can you hear me, Dr.
I can hear
Roman?
you.
Okay, great.
I can
Yes,
hear
so
you.
we're up and running. You're ready to go.
Okay. So what I want to cover is, you know, what when I first started out doing ozone, one of the things I was doing in a conjunction with it was acupuncture. And I was always trying to figure out, why my acupuncture seemed to work better. Why was it working better? And, as I started learning from other doctors, mostly it's all human physicians and human conferences, I was trying to tease out why they were seeing such improvement. And again, I'm going to push people to go watch Zachary's lecture again, because he looked at the biochemistry and looked at some of these things that make it a little bit more understandable in a scientific way of why these things work. Okay. So this is my clinic, MASH in Hopkinton. I've been doing integrative medicine for my whole career, really. I was lucky to take the veterinary acupuncture course in 1975 as the first woman, and that's sort of my claim to fame, is that I took it as, when I was really very young. And so it was really an eye-opener to keep my eyes open. And for any of you who are starting doing this, it's like you suddenly can see another opportunity that will help an animal. And mine was inspired by my horse Champ, who was told by Tufts that he had 2 days to live. He lived 8.5 years with cancer, but lived 2.5 years after they said he was going to be dead in 2 days. And he had cancer, and I used it as a cancer adjunct with him. And because I was I was asking people, and Tina Aiken and Judith Shoemaker, just insisted, why don't you try ozone? I'm like, I've never done, I don't know. I've read about it, but I didn't know anything about it. And so I was just sort of like, when you don't want to give up on somebody, you want to try something else. So I added the ozone to his therapy, and I saw miracles. I mean, this is him, riding in a field about 6 months after Tufts said he was dead. And he was jumping in horse shows, and he was almost 27 in that picture. So there's possibilities. This is my clinic in Hopkinton, and I'll move this over here because you're missing, I think, some of this. Anyway, we're going to move. Anyway, okay. So again, it's very warm. Everything is feng shui. We use only environmentally conscientious materials. So the animals are more relaxed. We all have natural lighting in each room. So it's just a warm place to be. And this is our ozone and biophotonic area, where we do a lot of the ultraviolet therapy. We also have the hemolumin, which we have a separate room downstairs where we have the photobiomodulation and a hyperbaric oxygen. So, what is adding ozone to acupuncture? Well, it adds the O2 and O3 to the fascial layer, and I think just cools the area because the inflammation is there. And this is not going to be a real scientific analysis of the actual pharmacology that happens in fascia, because I don't think I know that. But what I've realized is that, we pass our needle through ozonated saline, in which I flood the area, and I'm going to go over all this stuff. And I flood an area with ozonated saline, and then I drive my needle through that. And so I'm driving the needles into the acupuncture points, and I'll give you rationale of what I think how it works. And you can inject ozone gas directly into the points as well. And we are going to have, Jean Joaquin's videos at the end to show how he does it in Brazil. And mostly my treatments are mostly sub-Q ozone, or utilizing the biophotonic blood that I use into acupuncture points. And it increases the chi in the body and gives more oxygen to the mitochondria, detoxifying and supporting the immune system. So if we look, all of you, well, some of the lay people may not have that are taking this, but, acupuncture is a form of Chinese medicine that has been used in China for more than 4,000 years, and in veterinary medicine since 1972 in the United States. Based on a mapping of the body's meridians that follow the main organ systems, the yin and the yang qualities are brought into balance, and understanding how the body's organisms relate to each other make the Chinese medicine a very effective and accepted therapeutic option and action. While almost all ailments can improve, most common treatments are musculoskeletal, kidney disease, liver disease, wound healing, and pain management. And these are all the things that ozone does too. So if you can double your benefits by adding the ozone into that fascia that's running the acupuncture points, that's where I think it really helps in multiply the results. So if we look at this application picture of ozone therapy, we generate ozone from the generator at the side here. I'm not sure if I can get my cursor to work. 1 second. So from the ozone generator, when you see the oxygen tanks, and then we can bubble it through the saline maker and make the saline, and then we can deliver that in all different forms, in all different ways. So you can give it as a bolus under the skin as we do sub-Q fluids, because we all do sub-Q fluids on animals. And using the saline as your carrying agent for the ozone, there are some, little bits of chloric, hydrochloric that form, but it's really supporting the ozone in the saline. And then you're giving it subcutaneously. You can flush ears, you can flush eyes, you can flush dental pockets, you can flush mouths, you can do so many things. So whatever you could use saline to help clean, if you could use ozonated saline to clean, you're just potentiating the healthy tissue underneath and increasing your chance to get rid of the biofilm that's causing an area not to heal properly. So you can also run it through water and olive oil, as you see on the bottom, or just run it through olive oil. And then if you run it through the olive oil, you can actually breathe it at a low micrograms per milliliter. But if we're going to give it in the lungs, you cannot breathe ozone as a gas directly into the lungs. You'll be hacking for days, and it's not healthy to do that. So like any kind of therapy, too much of something, even water, will drown you. So too much ozone will hurt your lungs. Too much water will also kill you as well. So doing it in the ears, soaking paws, gassing paws, these are all these applications. So we use ozone to reduce the pain in the area. And I've been doing that by putting ozonated saline over painful areas, and the pain would stop. Injecting gas right into a painful area, and the pain would stop. And giving major autohemotherapy and utilizing that and putting some of that solution into the pain area, that helps reduce the pain. And getting more oxygen utilization that increases circulation will decrease the pain. So the energy deficient theory of aging and degeneration, these are from Frank Schallenberger's book. And degenerative disease and aging are preceded by early onset mitochondrial dysfunction, which occurs long before the actual mitochondrial decay. Commonly occurs in young and the asymptomatic. The presence and can be determined by the oxygen utilization analysis using respiratory gas analysis testing. But it decreased, mitochondrial dysfunction results in two common occurring states: decreased fat metabolism, which leads to decreased total oxygen utilization, further compromised by stress, ischemia, hypoxia, toxicity, infections, sleep deprivation, methylation disorders, nutritional deficiencies, and hormonal deficiencies and inflammation. So the reason for putting this up is that what ozone does is that reverses that. So anywhere that you can get the body to help reduce these symptoms, then our acupuncture is going to work more efficiently. So again, medical ozone increases oxygen utilization, and degenerative disease is caused by this mitochondrial decay and lack of circulation, I think, through the body. And if the mitochondria aren't working, then everything is not really working the way it should work. So according to Schallenberger, he feels that increases a decreased state of oxygen utilization is what it causes aging and weakness. And you get decrease of NAD to NADH, but ozone increases that NAD to NADH ratio and stimulates the oxygen utilization, which helps the body heal. So Zule Zamaro has written a book, and it's in English. This one's the Spanish version. And she has all the scientific studies that she's been spent 25 years studying. And we're in the process now, and she's working on it. I gave her like 106 cases. We want your cases. If you have interesting cases with interesting pictures, please send them to me, and we will get them into the book under our different, areas. She's been working on it. We've been working on it for a few years. Now, the ozone therapy, this is sort of a chart of how many therapies I've done, actual different treatments, but many of these are multiple treatments. So there's 21,000, but we've probably done at least 70,000 if you break them up into, we ear flushed, we get sub-Q, we soak the paw, that's like one treatment. So it's a lot more. So defining fascia, according to recent task force, the Fascia Nomenclature Committee, or FNC, of the Fascia Society. In fascial systems define the flowing morphological and function of the connective tissue related to a network of interfacing, interrelated, interdependent tissues, complex, whole, or collaborating to perform movement. The defined ultimate purpose is three-dimensional continuum of soft collagen containing loose fibrous connective tissues that permeate the body, such as adipose, adventia, neurovascular aponeurosis, deep and superficial fascias, epineurium, joint capsules, ligaments, membranes, meninges, expansion, periostea, retina, septia, tendons, visceral fascia, and intermuscular and intermucosal, including endoperium and impimysium. Fascia system interpenetrates and surrounds organs, muscles, bones, and fibers. And that's where we in veterinary, when I taught at Tufts, and I taught anatomy for 8 years, and fascia was something that I knew from acupuncture, but it was when I'd watch some of the older pathologists, they would just dissect that stuff and say, it's just garbage. We don't need to know anything about it. And I would always have my students go look at it and go, what else is in there? But according to anatomists, nothing was in there. So it was pretty interesting to sort of look at that. So I hope you can see this picture, because it's being, let me push this over here. But this is sort of a complex system of blood vessels and all these different fibers that are present, and they all need oxygen. They all need to be serviced by oxygen. And the signaling that goes through there is part of what we think the meridians go through that area. And these studies strongly confirm that the neuromodulation property of the mechanical stimulation of the fascial tissue, not only induced by acupuncture, but also through manual therapy such as shiatsu, tuina, fascial manipulation, osteopathy, because the fascia's receptivity to pressure and the role of touch into the interoceptive and limbic pathways include the default mode network. So what it's trying to say is that this is such a complex system that is getting respect from other healthcare providers, and as veterinarians, we need to respect it too and utilize it when we do this acupuncture with the ozone. Oops. So what's so special about fascia? Fascia, a restricted fascia stops or reduces cellular respiration and the flow of nutrients and removal of waste away from our cells. Respiration is essentially a cellular function. If we can't function properly, then we can't function. So it's very important. Indeed, acupuncture has been proposed as a useful therapy to activate the vagal anti-inflammatory pathways in the brainstem, confirming by neuroimaging studies in the so-called acupoint brain organ theory. Comparing the acupoint brain theory, these studies have confirmed that acupuncture recruits brain networks involved in the integration of multiple brain functions, the limbic, paralimbic, and neocortical network, which plays a major role in modulating the effective dimensions of pain processing and the integration of emotional, sense-emotional, auto, and immunological function. So according to TCM, acupuncture points are linked together in a network of channels through which flows meridian qi. And despite the definition of these channels remains elusive, there are several studies reporting anatomical and functional correspondence between meridians and fascial systems. So we're just feeding oxygen to the fascia, and we're utilizing that and getting the acupuncture needles through that. So again, here's a diagram here showing how the acupuncture needle is put into the fascia. And as we do a twirling of it, we're causing an activation of the fascia and the different receptors in it. When we flood that with oxygen and ozone and we're putting that in there, we're also, I think, reducing the inflammation of that fascia, which could be the source of the pain that is there if it's a B point and you're putting it right into that point. And then you put your needle in it and you're just sort of making it even more activated. So you can see all the blood vessels that are in there. And if you do have a high congestion from trauma, there's higher amounts of CO2 that's in there because the circulation is not in there. So here's some other diagrams of fascia, and you can see the intricate pieces of it. And we just don't know enough about it to really, we haven't been utilizing it as part of our care. again, and I think ozone seems to potentiate our acupuncture. So, this is a dog that I presented where it was paralyzed. And I was told that it had a lesion somewhere in that area. And we just flood the whole area, the whole back with ozonated saline, and then just did my acupuncture through it. So we just hook up from the saline IV and run that fluid along the whole back and then just do your acupuncture. And the dog was walking out afterwards. So it's those kind of cases. This is another one, Penelope, who was told that she needed immediate back surgery or she'd be paralyzed the rest of her life. And this was from Angel Memorial, and the people didn't have the funds to do it. And, they came to my clinic, and, she didn't have the money, and she couldn't express the bladder, and she was on that verge of euthanizing the dog. And so, again, we flooded the area because I didn't really get exactly where the lesion was, because it was somewhere between T3 and L1, which is a lot of area to think about where it is. So I just figured, okay, let's just flood that whole area, acupuncture that whole area. And within 3 days, the dog was totally normal. So these are the parameters I used. This was the acupuncture points that I used. And when I started doing ozone, I always was bubbling my saline in a very high amount, because I was told that the saline will only saturate up to about 37 micrograms. At this point, we use the word gamma, but we're supposed to be using micrograms per milliliter because they want to have an international consistency on using the term. So I was bubbling very high, and I've kept it that way. And I still have really, the good results. So we bubble it, probably around 70 micrograms per milliliter. In this case, it was going higher. I had a different machine, but I bubble it, and it basically just saturates to a certain point. If you refrigerate it, and which I haven't done with my saline, but I do it with my water, then we can get it higher, and that's what I use for drinking. And we did Moxa. We did all these nutritional supplements as well, and homeopathics. And so that was the success, is I think bringing it all together, using things that aren't negative to the animal and bringing the animal into balance. Getting chiropractic. I have a lot of help from two chiropractors, Ann Kraushaw and Jennifer Chung. Both are excellent, and I've taken the chiropractic, but they are better, and we share and work together and get these animals moving. And then 4 days later, 1 month later, she's doing great, but 3 days later, she's walking normally. And then she was totally back to herself and lived for many more years without any back problems at all. So again, using it, here's another one again that we're doing it. These are these little dachshunds that have such problems. So, with my horse, when he had his eye taken out because he had cancer, we used acupuncture around the whole lesion for pain and management, but he was getting intravenous direct IV ozone. So he systemically was getting ozone. And then we were using that for pain management, and the acupuncture needles around the eye, circle the dragon area, to bring circulation into that area as well. This is right after surgery that he was getting support. So here are some ways of making ozonated saline. You can make it in a bottle like this, and this is developed by Dennis Mahalka. There's this O3 Vets bubbler too as well. So there's different ways of making ozonated saline. And you can see how it's just bubbling here, right in here. And then this one, I put these in. This is the Dr. Showmore calendar that we did in 2011 and then 2013. But doing acupuncture, we've tried to educate the public on why acupuncture is so amazing as a modality. And so I just wanted to put those in. And then we did another one where we were doing, more stuff about ozone. And this is Geneva in the front here, who is also one of my major teachers. She is my dog who lived with malignant breast cancer for 7.5 years, getting ozone pretty much like 3 or 4 times a week. And she had a thoracic, mass of cancer metastasized for over 3 years, but documented for a year. I mean, the size of her heart, and was still running along with the horses. So not fast, but still going along with the horses. So she lived with her cancer, and I think I owe it all to using the the saline and there. Okay, so this is setting up your ozone generator with your saline makers, and we have them on IV poles, and you got to make sure they're counterbalanced if you're going to move them from room to room, because they will tip over, and so we have like different counterbalances on them. I also use tachyon, which is a silicone disc that we put next to the glass cylinder to help break up the molecules. And I'm building a new addition to my house, which will be, work as a garage and also a teaching space as well. And we're putting the tachyon into the paint, so it removes EMFs and it balances out the body, the building too as well. And here are some other ozone generators. You've got these are the Ozonettes on this side with the Senegal's group on the right, on the left. Let me go back 1 second. And then you've got the Promo Life, and then you've got the O3 Vets and the Longevity. So there are wonderful machines out there that have other ways of delivering, but they're all very good. Again, there's different ways of delivering the saline. At the top left is is what they're doing in Europe to treat COVID in the hospitals in Madrid. So this was the IV setup that they treated 600 treatments and got everybody out of the hospital. If you haven't read that literature, please do. We have a treatment that has been suppressed, and it's really important. On the bottom here, we send home the saline in an IV glass bottle, and we dispense it to clients to continue giving after the treatment. And then again, this is our treatment area. So here's a video of making ozone, how they do it in Brazil in the field. So they bubble the ozone, oxygen, and then they make holes in a saline bag at the top, and you'll see that little holes, and they bubble it through the IV bag. I think it's way better to do it in glass, but in the field, when they're working in the field and they can't take the delicate glassware, they are bubbling it like that, and then they're using that as an ozonated saline to flush wounds and everything else.
Very, very simple way to deliver ozonated saline.
So here are some resources. And of course, I'm looking for an associate. So here's an opportunity. There's 63 people on this lecture. I would love, we need another vet who likes doing, creative ways of doing stuff. This is our waiting room for, that we have for, and we had an open house. And this is a picture I just recently found of myself in vet school with my dog. And I called it the canine cardiologist. But I learned from my animals, and it's a doctor's journey to figure out why things are working. Why is something that you learned in school doesn't seem to give you all the answers. And so you got to listen to the animals, and they listen to you. So
Dr. Roman,
I wanted to have time to show these videos of injecting ozone gas into acupuncture points that Dr. Jean-Joachim did. This is one on the knee.
Margo, can you hear me on there?
Yeah. Mm-hmm.
Okay, we got about 7 minutes left on this lecture.
Okay, so this is his injections. So he's using gas just directly into the space, and they use the gas just like they would inject a B12 or something, but they put a little bit more volume into the points. So he's putting the gas right into all the acupuncture points that I will do. Not some of them I'll needle and some of them I'll put B12 into, but he's doing like, looking for stomach 36 or, gallbladder 34 probably. And, so he's going through and just putting ozone in there. And I've done that with the UVBI solution, as well as with, minor autohemotherapy into certain acupuncture points too, as well. Okay, so then the next one, this is in the neck. So he did thermal imaging, looking at the neck, and I'm not sure if he's. Now, ozone will go where it's needed. So if you're injecting it and it's close to where there's a congestion of CO2 or tightness, the gas moves through the fascia. So it moves through there and it lifts it up a little bit, I think, to give even more space where there's been changes. Let's see next. Okay. So anyway, that's the end of this lecture. I will stop sharing my screen. And Dr. Hakeem's on there, and he could give it any other pieces of it. So it's really important. What?
I'm sorry. Yep. No, you're great. Go ahead.
Okay. Should I keep going? Okay. So Jean, if you want to tell them a little bit more about how you did the sub-Q, go for it.
Hello to you all. Hello, Dr. Margo. It's a pleasure to be with you again, and
great.
all the guys on this summit. Well, we have used the acupuncture for ozone therapy since we have some safety points to inject. So acupuncture brings the safety when you want to inject something, because you already know the anatomy behind the points and the safety to put a needle on those points. So we put those therapy together to have safety and, of course, to have the benefits of acupuncture point stimulation. So it's a symbiotic treatment that's very useful on daily basis for the treatment of small and large animals, and even exotic animals as well.
And just to highlight the Brazilian group, they have their own organization of ozone veterinarians, and when I got to be their keynote speaker in like 5 years ago, they had 600 members, and it has been approved by the Brazilian government that ozone is a modality for both veterinary, dental, and medical care. So it's really important that we push our veterinary boards and to understand that these methods are so important, especially with the overuse of antibiotics that we have right now. We have tools that will help with infection. We have tools that will stop pain. Opiates and antibiotics are from the 1900s. We need new tools that are helping heal people and heal animals and prevent infection.
Wonderful. Well, yeah, go ahead. Actually, we're going to have to move to a Q&A time if that's okay. And it looks like our screen's going to be going in infinitum. So thank you, Dr. Jean, for being here and for jumping on at the end of this lecture. I want to take a few minutes, if we can, and just answer a few questions that we have already from this lecture. And if both of you can just stand by, and probably predominantly, sure, since it was Margo primarily talking for her, but we may have some for Dr. Jean as well. First up, can you expand in less than 30 seconds on what bioenergy testing is?
So bioenergy testing, Dr. Schallenberger does that, where they look at your respiration rate and they take your CO2 and your oxygen and they measure that. They put you on a treadmill and they try to see how much oxygen utilization that you have. So it is a special test that he does. There's nothing that's available in animals right now. So it's a way to evaluate what your mitochondrial function is. Maybe there is a way to do it in animals, but I haven't really been looking for it. If anybody has, please let me know.
Great. So the next question is, when you give ozone intramuscularly, it hurts. How do you get around that?
Yes.
How is that dealt with?
So, you know, what I do when I have to give it, if I'm giving it for a reason like osteomyelitis and I'm injecting it into like the back of a humerus, which I gave a lecture on before, you know, I give Procaine with it. So that will reduce the pain going in. Using a lower micrograms per milliliter, you know, down to less than 15 or to even 10, it stings, but it doesn't sting that much. You know, getting down to 2 or 3, they probably won't even feel it. But it almost would be the same as an acupuncture injection of B12, you know, that it might have a little bit of a sting, but not much. But anything higher than like 12 or something like that probably stings. What, do you agree? Or John, what do you think? Because you do more of that than me.
We use 6 to 10 micrograms per milliliter, very low concentration when you have an inflamed place or if you have a sensitive dog. And if you want to use high dose, you have to think about pain and sting. So sometimes it's necessary or to sedate the dog if it really means that it's necessary to use high concentration. Otherwise, low concentration can be used. It can be very effective. I think high concentration in ozone therapy is a myth. We have a very good clinical response with low concentration, and you can avoid pain and make ozone being a very comfortable technique. The volume is important as well, because if you have a lot of muscle or tissue distension, then that can hurt as well. So you must be aware of the place you want to inject. If you have a lot of empty space on the subcutaneous, or if you don't have it, so you can reduce your volume to be very comfortable for the animal.
Good. How about here on site? Are there any questions that anyone wants to ask? There's a lot online, so I'm giving you a quick chance here. Okay, let's jump to an online. So Dr. Broadfoot says, Margo, that she can't find glass containers. Is there something you use?
Yes, so you have to buy it through your distributor. I get it from Midwest, and they come in 500. They used to come in 500 and 1,000. Now we can only get the 1,000. So it used to be that when your saline would come to you 30 years ago, it came in glass containers just like this. Now we have to buy them they're about $15 or $18 a bottle to come. And we use them over and over and over again with the same client. So we do like 4 treatments of ozone that they do every 6 hours. So we send it home. Let's say for a dog that's like 35 pounds, I might do about 150 cc's every 6 hours over an area that I want to continue doing ozone. Or let's say if they have a bladder infection and I want a dog doing that now who has transitional cell carcinoma and it's a female, so it's hard to catheterize. So we're sending them home and giving them ozone sub-Q over the bowel and the pelvic area, just bringing it right into that area. And allowing the animal to, to have the fluids. And so we send it home, we keep it refrigerated. After about 24 hours, 30 hours, it's probably just saline, which is okay. It's perfectly fine. And then I have them bring the bottle back because the ozonated saline is going to sterilize the bottle, and then have them run it out the drip right away. So we sterilize the line and have that sterile again, so we can keep reusing that glass bottle over and over again. So what we do is we dispense that, we charge for the bottle, and then we have a fill-up charge depending on the volume of saline that they pick up.
Okay, great. So a question that a few people have, actually 4 or 5 people had the question about it stinging. So, and how to mitigate against that stinging. And I think you already answered that a little bit and talked about the concentration being lower. Nothing else, I guess, to add to that, or if there
No,
is,
I
fine.
mean, on the sub-Q saline, some dogs, if you give a sub-Q fluid, they scream from lactated ringers. They don't want anybody doing anything to them. So some animals just sit there, and you can run this. We run it right in the room with the IV saline right under the, we just bring it in the room, run it in like an IV pole, and then take it out. And some dogs will sit there and do absolutely nothing. You'll have another one who scream like somebody threw a cold ice cubes down their back, and they're like, trying to get away and squirm and get away. But that's why I use the ozonated saline so much, is because it's easy for me to do because we're set up in our clinic. But again, in Brazil, when they were all injecting the gas, it was like, wow, this is even easier, now to make the saline. But I think there's a value to the saline too. I think there's some qualities to it that I think are really positive. So both techniques, I'm nervous a little bit sometimes about putting gas directly, in a volume into something, but because I did that once, and I've done it like twice on animals that had cancer in those areas. And one cat, just like it was a story that I tell people, because I always tell people my negatives because I don't want them to do my negatives. And so it was a cat that had fibrosarcoma on the foot from a vaccine. And it was a foot that was deformed. And so the veterinarian kept injecting into that leg, and it got a tumor on that leg. And I thought, well, let's just try to see if we can shrink it with some ozone. And the owners said they wanted the cat put to sleep. And I said, no, let's just try this. And they said, no, we really want the cat put to sleep. And I injected some ozone gas, and the cat just went like, I think it was the pain, because it was a little higher in micrograms. And I think it just went like, held its breath, and then just dropped over. And they said, don't resuscitate it. And I'm going, no, I got to resuscitate it. So I don't know whether the cat wanted out on this world, and they had picked up on that, or something happened. But they wouldn't let me try to get the cat to come back again. So that was my really bad experience with injecting into a tumor at a little bit higher, where it might have stung, and the cat was just ready to go.
Dr. Jean, do you have any comment then on that whole area?
Yes, I would like to highlight the situation of sting and pain on ozone acupuncture injection or ozone injection. It's important to know that it can be very painful. So we advise not to use over 12 microgram per milliliters. If you go from 6 to 12, you can inject it without discomfort. But if you want to use high concentration, you must be aware that it might be painful. So we don't have so many problems with ozone in the lung, breathing, the toxicity of ozone that we have in the respiratory system. The main problems we have heard about ozone therapy are with pain, and we can have a shock, a neurogenical shock with this painful injection. So if you just manage your concentration until 12, it's safe. But if you want to use high concentration, be aware that it might be painful. Of course, small volumes with high concentration can be painful for seconds, for just a minute, and might not be dangerous. But if you use a lot of volume of gas with high concentration, yes, we can cause some problems with the animals.
Good.
So just like any technique with surgery, you can cut an artery. With injection of some drugs, you can also have collateral effects. Ozone can do that as well. That's why we need to know what we are doing and have good training on this.
Yeah, that's why we're doing this, right? So
yes.
Right.
So one more question, Dr. Jean.
A last comment.
Yeah, one more question.
Make people get afraid.
No, go ahead.
Just a last comment. People, don't be afraid of ozone, because in Brazil we are about 3,000 vets doing almost 95% injection on acupuncture or non-acupuncture, but use injection of ozone. and we don't have problem. It's
Great.
You
just,
have 3,000 now?
yes, yes.
Oh my God. Oh my, that is so wonderful.
So it's safe,
Wow.
but be aware of some details.
Great. Well, thank you
So
for
I
that.
wore my
Mar-
Churchill Downs shirt because today's today.
That's awesome.
But
Mine
the
is much more
horses,
plain.
they benefit so much by getting, ozone, and doing, injecting ozone into painful points and in doing that. And their large animal vets are doing it there in Brazil too as well. So we didn't have any large animal cases, but in honor of the horses.
Okay, so I'm going to ask one more question, and then we have lunch going on. For you guys, I don't know what you'll do there online, but whatever you want to do. Dr. Jean, maybe
He's
get a
drinking
wine
wine.
or something. Yeah, that's great. But the last question, I'm going to start with Dr. Jean, is about volume. So what would you recommend volume-wise for acupuncture points on various animals?
I'm going to talk about doses a little bit when we talk about upgrading research. The Madrid protocol tells about 1 to 2 milliliters of ozone at acupuncture points. Of course, in a large dog, we can use 5 milliliters per point, and in horse, some points on the back, we can almost use 60 milliliters. So it depends on the anatomy, but generally, you can use 1 to 2 milliliters at acupuncture points, 5 milliliters in large dogs and horses, 20 milliliters, 30 milliliters, something like that.
Great. And Margo, do you have any comment on the dose in particular, or?
On the ozone, well, when I use ozonated saline, there's several parameters that I look at, and I don't have like exact charts. If the animal has a cardiac or renal issue, and I'm concerned about the sodium content of the saline, then I will try to reduce the amount of saline that I give in the volume that I give, and I'll increase my rectal ozone. So I sort of have a total amount that I want to give, and I'll go ahead and reduce the amount of saline so that I'm just giving more rectal ozone, getting more ozone into the system.
Great.